Hi everyone, my name is BINTI HAWA and today I'll be explaining about a skin disease called rosacea. So first of all, what is rosacea? Rosacea is a chronic inflammatory condition that causes blushing and visible blood vessel in the skin, especially on your face. So usually rosacea will affect the cheek, the chin, and also nose, and some will develop rosacea on their eyelids as well. So first of all, I'll be explaining about the anatomical structure of the skin. So the skin consists of three layers, which is epidermis, dermis, and subcutaneous tissue, or also known as hypodermis. So firstly, for epidermis, epidermis is the outermost layer of the skin. Next is dermis. Dermis is beneath epidermis, and it consists of connective tissue, hair follicles, blood vessels, lymphatic vessels, and sweat glands. And next is subcutaneous tissue, or also known as hypodermis. It is the deepest layer of the skin, which consists of fat and connective tissue. Here we can see the comparison between a healthy skin and also a rosacea skin. So we can see that the healthy skin is clear and healthy, while the rosacea skin has inflammation and visible blood vessels on it, and are also some small pus-filled bumps. So what is the physiological function of the skin? So the physiological function of the skin, firstly, is regulation of body temperature. Skin helps us regulate our body temperature through evaporation of sweat. And skin is also a protection for us. So it protects us from the UV radiation, which is also known as the ultraviolet radiation. Next is sensation. Skin helps us to detect stimuli such as temperature, pressure, and pain. Next is excretion. So skin helps us to excrete small amount of salt and some organic substance through sweat. And finally, immunity, where skin protects us from foreign invaders such as bacteria and viruses. Next is what is the symptoms of rosacea? So the symptoms of rosacea is facial blushing. You can see your face are turning red and has some blushing effect on it. And next is visible blood vessels on nose, chin, and cheeks. Next is swollen bumps on the affected area on face. And you can feel burning sensation on your skin. Next is dry, irritated, and swollen eyes. So rosacea will not only affect your skin, but it can also affect your skin around your eyes and also your eyes. So here is the picture of an eye irritation. And finally, enlarged nose, or also known as rhinophyma. So enlarged nose is caused because of skin thickening around the nose because of rosacea. So here is the picture of rhinophyma. Next, what is the treatment for rosacea? So treatment for rosacea is topical drugs that can reduce flushing, and doctors can give you oral antibiotics, oral acne drug, and also laser therapy to help to reduce the redness on your face. And next is prevention. What can you do to prevent rosacea? Is protect skin from sun. You can minimize stress, avoid overheating, and you can simplify your skincare routine. Next is opt for mild foods such as vegetables and fruit juices, and limit alcohol intake, and protect face from harsh weather such as wind and cold. Next is diagnostics of rosacea. So there are no specific tests used to diagnose rosacea, but instead it can be diagnosed based on physical examination of the skin and eyes and history of the symptoms. Next is prevalence for rosacea. So approximately 415 million people are affected of rosacea, which means 5.46% of the population worldwide are affected. And 16 million Americans are suffering from the signs and symptoms of rosacea. And in Malaysia, 1 out of 20 people are affected by rosacea. That's all from me. Thank you.